Spinal mobilization with arm movements. Spinal mobilization with arm movements are good to use as assessment and treatment if you suspect the patient's arm symptoms with arm movements have some spinal origin. When we do our spinal mobilization with arm movements, we can do them at any level of the cervical spine. We're going to use the side edge of our thumb, not the pad of the thumb, but we're going to try to turn the thumb over and use the side edge of the thumb on the side of the neck. Placement of the thumb is important for comfort and for effect. If you have the patient lift their shoulder up a little bit, shrug up a little bit, you can kind of get an idea of where that upper trap runs. Try to think about positioning your thumb anterior to that, and then moving your thumb using your other two fingers as the mobilizing fingers in a medial and obliquely posterior direction. Kind of back in that direction. The direction may change subtly to a little more posterior, to a little more medial, based on her response. And I just use this hand for the mobilization, and I pull obliquely posterior and sustain that force. Then I'm going to ask her to raise her arm up. All the way up. Do you have any symptoms with that? Again, we're looking to take away the arm symptoms with arm movements by using the mobilization at the neck. If you can zoom on in a little bit, come on and closer here, so I can show the side edge of the thumb. Now remember, this part is relaxed. I'm not squeezing. I'm not mobilizing with this thumb. I'm mobilizing with my fingers, pushing through the thumb and back. It's comfortable, and we're affecting a lot of structures, okay? Skin, fascia, muscle. That contact through that fascia and through that muscle tissue onto the spinous process. So we're affecting a lot of different things. Now, motions that might commonly be used with this are flexion like we just did. How about horizontal flexion? I sustain my force here and reach across your body. If you don't have any symptoms, give it a little overpressure. Good. How about hand behind your back? Are you able to get that hand up your back without that pain now? Good, and come back down. Okay. Or how about resisted movements are giving them trouble in the arm, shoulder, elbow? So if I hold there and you press there, do you still have that pain you were getting before with that contraction of that muscle? Or how about lifting your wrist and push down on the wrist? Okay? All while sustaining the spinal mobilization with arm movement. Spinal mobilization with arm movements can be really helpful in neurosensitive patients as well. So what I'm going to do here is just have you turn a little bit so we can see better. Yeah, okay. And what if we have loss of motion or symptoms with a median bias position? Or maybe an ulnar bias position. Good. Okay? Or radial bias position. Okay, so we kind of note where the symptoms come on and the location of the symptoms. We apply our spinal mobilization with arm movement. The level in which you apply, you can try to use your good clinical reasoning for this too, based on what location of the hand are they getting the symptoms? What nerve are you suspecting? I can change levels based on that. It might be a little bit higher for that median and a little bit lower in the cervical spine for that ulnar or radial nerve. Now, that may be where you initiate the spinal mobilization with arm movement, and that's a good idea, but remember to switch levels, try different levels, move up, move down, because what this is all about is really eliminating the symptoms and allowing her to move functionally and allowing her to move in those previously painful positions. So we can start with some good clinical reasoning, but at times you'll find it's a little higher than you think or a little bit lower than you think. So feel free to use that when you're in the assessment part of our spinal mobilization with arm movement. All right, so I may apply that force and go ahead and do that median nerve again. Good. Hoping for more motion and elimination of symptoms. Okay? How about that ulnar? Good. If she says, I still have a few symptoms there, I may move down. Okay. How's that? Try that ulnar again. Okay? Good. Or the radial nerve. Okay? So your force, the amount of force that you're using, and the level that you're affecting can change based on the symptoms. And whatever level you find to be symptom-free, that's the level you'll apply. The number of repetitions can vary based on irritability. Maybe if you have somebody that's highly irritable, you decide to do one solid, good, pain-free rep and call it a day for day one. See how they come back. Or if you're a little bit less irritable, you suspect your patient's a little bit less irritable, maybe you do up to 6 reps on day one. That's your decision to make. But all the reps need to be symptom-free.